Good afternoon, everyone. My name is Shannon Roberts, and I'm here to talk to you about the moral model. This tool is very helpful in nursing practice when dealing with an ethical dilemma. It will help you closely analyze the situation and arrive at the best solution. The M in moral stands for massage the dilemma. This is when you're going to gather your information and identify your facts. The O stands for outline options. It is just like it says. You're going to take the information that you've already gathered and the facts that you've identified, and you're going to make a list of options. You want to try and have at least 3 options to choose from. The R is when you're going to review criteria and resolve. This is when you're going to take your list of options and you're going to determine your best and worst case scenarios. When you're going through your best and worst case scenarios, you want to keep in mind the American Nurses Association Code of Ethics. The A stands for affirm position and act. This is when you're going to take your best and worst case scenario, your list of options, you're going to determine which one or make a choice, and then you're going to develop your plan. The last step, the L, stands for look back, and that's with everything else in nursing. You're going to evaluate the choice that you made and determine what your outcomes were from that choice. So what we're going to do today is we're going to take the moral model and we're going to apply it to a scenario. The scenario is a 95-year-old woman who is terminally ill, dying of cancer. She is on hospice care and she is at home. The family is kept vigil at her bedside, and a hospice nurse and a hospice aide comes in daily to see to the patient. When the nurse arrives today, the family begs her to administer a lethal dose of morphine. What does she do? So let's take the moral model and apply it to this scenario. So the M, we're going to gather our information and identify our facts. Well, we know that the patient being on hospice is a DNR. We know that the patient is unconscious, so she is unable to tell us what her wishes are, so autonomy won't apply here. We also know that according to the Code of Ethics, there is a prohibition that states that nurses may never act with the direct intent of ending a patient's life. We can only ease their suffering. So we've got our facts and we've got our data. Now what? Now it's time to outline our options. Option 1, we can contact the doctor if we feel that the ordered dose of medication is not keeping the patient comfortable. Option 2 would be to, if the medication is found to be keeping the patient comfortable, continue to administer that medication. Patient's taken care of. We need to focus on the family. Option 3 would be to administer the medication. So we've got our options outlined. We've got 3 good options there. So now we're going to go to the next step, which is the R. We're going to review criteria and determine what our best and worst case scenarios are. Best case scenario is that the patient is kept comfortable until the end of her life and the family is comforted. The worst case scenario is that the nurse administers the medication and breaks the law. So now we've got our best and worst case scenarios lined out. We've got our options, we've got our facts. Now we need to act. We need to affirm our position and act. So what are we going to do? Well, we're going to assess our patient. First and foremost, our plan is to assess our patient. Our patient is found to be comfortable with no signs and symptoms of acute distress. So now that we know that she's taken care of with the ordered doses of narcotics, we need to turn our attention to the family and develop a plan. So we're going to engage them in therapeutic communication, and we're going to encourage them to develop a schedule where A few of them are at the bedside or taking care of the grandmother, while the rest of them either rest or go home, take a shower, try and get back into some of their normal routine, get out of the house, take a walk, and kind of de-stress. We also want to engage them in conversations of happy memories with their grandmother and just kind of bring the situation down and assure them that their grandmother is comfortable. So we've acted. Now we want to look back. How did it turn out? Our patient is taken care of. Her distress, she's not in distress. Her suffering is eased. She passes away the next day. The family is doing a little bit better with their stress. They were reassured that their grandmother was comfortable until the end. So situation resolved. Moral model is easy and it's great to use in your nursing practice. Thank you very much for coming out today and listening to my seminar, and I hope you take the moral model back with you and use it in your everyday practice. Have a great day.